We have some BrightView team members here with firsthand experience helping our patients rebuild their lives, and we're going to have them walk you through those slides today. Lois Miller-Martone is a telehealth therapist for our Ohio patients. She has dedicated her career to patient-facing and leadership roles across all levels of care in the addiction treatment field. She's joined by Sarah Goodlett. She is a counselor working with our Kentucky patients. And in addition to her professional experience, she's also in recovery. Sarah has dedicated the past 16 years of sobriety to supporting others on their recovery journeys. And we appreciate her joining us today, as well as Trevor Williamson, who also helps our Kentucky patients. He's a lead targeted case manager, and his passion for addiction recovery is influenced by his personal experiences, and it drives his commitment to helping individuals achieve and maintain sobriety. We are really excited to discuss today's topic with you. You know, case management and social support are a cornerstone of our comprehensive treatment program, any, good outpatient treatment program, honestly. And far too often, it's really a best kept secret. You can see some of the things that we are going to be speaking to today. And with that, I will let Sarah Goodlett begin.
All right. Hey, guys, and welcome to our forum. We'll begin just by explaining what social support is. It's a network of people and resources that help individuals through recovery, like family and peers checking in, regularly, just regular family members, and maybe through meetings and things like that. Community support, providing access to structured services like support groups. There's the support group thing. Housing and job training. Can these terms be used interchangeably? Yes, today they will be. Both types of support are essential in recovery, with social support offering personal encouragement and community support providing access to necessary resources. Next.
Hi, everybody, and thanks for joining us. Just talking about kind of how social support sort of really starts with our early human connections and how important it is, especially right now that our children are being surrounded with early support networks and healthy relationships, because we know that those build resilience, and resilience helps our children to sort of navigate the world that we live in and the potential for substance abuse and substance use disorder. We utilize a tool called ACEs in our therapeutic process, and it's available for anyone who may want to Google it. This stands for Adverse Childhood Experiences, and it's kind of a questionnaire that we can utilize with those that we work with to kind of look at what adversities did our patients face when they were children growing up. And what we know from this questionnaire is that the more adversities and trials that our children are facing in childhood before the age of 18, the higher risk they are for all kinds of things, ranging from health problems and difficulties as adults, risk for substance use disorder later in their adulthood, or even late childhood, and as well as risk for justice involvement later on in life. We also know that when people develop substance use disorders in their adulthood, they tend to be socially excluded and marginalized. And most of the time, this is because of the behaviors associated with addiction. They'll be breaking those connections with family a lot of times, or they'll not be participating in those supports that they had prior to becoming addicted to drugs or alcohol. Whether it was meaningful activities that they participated in or social circles that they used to be involved with. And we also know that specific to opioids use is just kind of an overall reduction in the desire for social connections. And whether that is part of just not wanting to be around people when someone is under the influence of opioids, or just the overall kind of numbing and disengagement that opioid use creates. Next slide, please. We also know from the SAMHSA website where this information was pulled is that there are 4 key dimensions that promote well-being and resilience in recovery. One is someone's health and managing and overcoming the condition of substance use disorder, but also once someone starts to address their substance use disorder, it's almost like a natural progression that they start to pay attention to other areas of their health that they may have been neglecting when they were using. So we see that as one dimension. Also, purpose. When someone enters into recovery and stops using drugs or alcohol, they begin to feel like they have purpose in their communities, in their families, in their jobs, their employment. So they start to engage in more meaningful daily activities, maybe returning to some of those activities that they really enjoyed in the past, but they gave up while they were using, or maybe finding a job or furthering their education. So they begin to have purpose. Also, we see another key dimension that is promoted well-being and resilience for those in recovery is beginning to have a stable and safe place to live, being able to maintain a home, taking pride in the home that they have, paying their bills, making sure that they are able to maintain that stable and safe place to live. And then also in their community, starting to build relationships and social networks with, again, reuniting with family, creating social networks, maybe through their church, or even engaging in some of the 12-step fellowships, but really just starting to engage in putting the investment and the desire back into building relationships in their community. Next slide.
So there are 4 different types that we're going to talk about today. The social support that she was mentioning earlier through SAMHSA, emotional support, just providing empathy and emotional value. This can be, like she was talking about, church and different things, but peer support groups, they offer empathy and connection, that sense of belonging and creating a safe environment or a safe place where you can go in and share what's going on with you. It's vital to be able to share those things. I feel like it's a part of the healing process. Information support, just mentoring, coaching, educating. That can be through community health centers that provide workshops on mental health and recovery, empowering attendees with valuable coping skills. So going to just different centers, ways like Voices to Hope, things like that can kind of mentor, maybe have coaches there that can support. Practical support, just tangible assistance, community organizations that offer transportation to treatment. They have food services and assistance, other resources, clothing, perhaps, places. It just eases, like the daily burdens for those in recovery. They don't have to worry about where they're going to get food or how they're going to get their next meal because they have these resources. Companionship support, just a sense of belonging. as I shared before, just shared experience and being able to connect the camaraderie. Churches, community centers that host social events. There's also other steps like support groups, basically, that are based in churches, and they utilize different things for social events. They foster connection and they reduce the isolation that's very, common in with addiction. So those are all really, really good, helpful types of social support. And without those, it's hard to kind of go through the healing process and get back on, your feet, basically. Next slide.
Good afternoon, and thank you all for joining us today. We appreciate everybody being here. Today, we're going to talk about a little bit of social support in real time, and how patients in active addiction or patients in recovery can obtain that social support in everyday life. One of the things here is that we need to focus on is community-based supports. Some examples of these, you've got 12-step groups and fellowships, such as NA or AA meetings. You have faith-based meetings, such as Celebrate Recovery. You've got CBT therapy-based meetings. You have Smart Recovery meetings. You also have online support meetings, such as She Recovers, Reddit, Facebook groups, other social media. Having community-based supports whenever someone is trying to overcome addiction is very important. Every piece of support that they can have is very important for them to have in achieving a successful recovery. And having access to these various different community-based supports is very helpful for them to achieve that. BrightView actually has their support programs that we offer as well. We have diverse group offerings. We have educational and support focus groups that we host. We also have virtual and in-person groups for flexible participation. So if patients aren't able to access them in person due to work schedules, life schedules, whatever it may be, we do offer the online version of those as well. We offer statewide virtual access. As I said, extends supports to patients across all states. So, whether you're in Kentucky, whether you're in Ohio, wherever the patient's located at, we want to make sure that they have access to the meetings and the groups that they need to achieve their recovery. Next. Just kind of want to go back over again some benefits of social support. So there's a couple different areas here that we're looking at where patients can benefit from social supports and having those support systems in everyday life. You have the healthcare needs, medical referrals and care coordination. A lot of times patients will come in, they may have cardiology diagnosis. They may be diagnosed with different communicable diseases such as hepatitis C, HIV, TB, and it's important that we connect them to the resources that they need so that they can be able to get the treatment that they need. Dentistry and dental hygiene referrals, inpatient addiction treatment referrals. If patients come in and they are prepared and ready to go to inpatient services and complete inpatient treatment, we want to be that, we want to bridge that gap to ensure that the patient is able to make a successful transition to inpatient from outpatient. You have mental health resources and referrals. When patients come in and that are dually diagnosed and have additional mental health diagnoses along with their substance abuse disorders, we want to make sure that we get them connected to the appropriate providers that they need. We also, the Pregnancy Resource Center. So also, we have patients from time to time that come in that are pregnant and they need to be connected to the resources they need in the community to be able to have some assistance in addressing their pregnancy and making sure that they have a smooth transition and a healthy delivery. Again, just another provider, primary care referrals for patients that need primary care. WIC, Women, Infants, and Children Resources. We want to try and connect all of our patients to those as well. We also have the legal affairs side of things. If patients come in and they're needing, a lot of times I've saw patients are needing new copies of their birth certificates, their social security cards, or their IDs, their driver's license. As we all know, those are things that typically we need to have in day-to-day life a lot of times. So we want to make sure that we get those patients connected to the resources that they need so that they can obtain those. Cash assistance and medical card, application for food stamps, treatment status letters for outside agencies. A lot of times these are things that patients come in on and they need our assistance with. If a patient is currently getting treatment from one provider and they're wanting to transition to BrightView, or if there is a patient that has a job that the employer is needing some kind of proof showing that, hey, I have an appointment that I have to come to on this day each week. A lot of times we can write letters out for things like that, or for any other providers that the patient is getting treatment with. Treatment updates for probation. A lot of times we have patients come in that are on probation, they're on parole, they have CPS cases, different legal situations. And we just want to make sure that we're working appropriately with that legal provider to make sure that the patient is, staying up to date with everything that they need to do for that entity. And so providing that coordination of care can help the patient with that. Holiday support and assistance, making sure the patients get connected to different holiday resources. At this day and time, a lot of people are struggling financially. So we want to make sure that the patients are connected to every kind of holiday support resource that they have, that they can get connected to, just to kind of eliminate that barrier or that stress that they have around this time of year. So next slide.
All right, so next we'll be just talking about empathy in action. So education and social services, maybe child care vouchers to help with child services. A lot of our patients don't have, the resources. They're unable. They're coming from the very bottom of everything, basically. So they need that extra help. Assistance with child protective services, educational resources, just giving them resources to go back to school possibly, employment counseling. So there's resources where we can send them to maybe get help with education or employment, resources. NA and AA meeting information. That definitely, I feel like that's a good resource to have, not only just to make that connection, but to have that support there in your corner with you, so you don't feel alone. Resume assistance and support, professional clothing assistance for interviews. And then we have the housing, which is super important. Because we can't do anything if we don't have stable housing. It's really hard to gain, a foot on addiction and, alcoholism and just kind of get back on our feet, basically, if you don't have the right resources, basically. Clothing assistance, housing and shelter support, food assistance and food pantries that was mentioned earlier, furniture assistance, and that can be from multiple resources. There's churches available that can provide the furniture assistance, mileage reimbursement, and then there's so many utility assistance services. And all of these, a lot of these can be through TCM services. And so not only is the coordination of care important, as well as the TCM services, and just working together to get these patients where they need to be. Next slide.
Yeah, and I think just kind of playing off of what you were talking about, Sarah, you know, all of our patients have so many needs as they're navigating early recovery, but I feel like our justice involved patients, they actually have an elevation, especially if they're coming out of jail or prison and reintegrating into our community, because a lot of times they don't know what you know, what services are available, what's out there. Luckily, our case managers and our counselors are able to sort of walk our justice involved patients through the process of what services and what supports are available in those individuals' communities that they can access, because they may have been out of touch of, you know, what was actually available. We know that those that are justice involved, and especially those that are post incarceration, are going to need elevated support. We all have the goal to reduce recidivism. And we know that without the supports in place to support someone coming back into the community, those risks are much higher for them to re-engage in substance abuse or high-risk behaviors that will lead to further incarceration. We also know that a lot of our justice-involved patients aren't going to have that family support. And so anything that we can do from a justice side of things to try to support the family and reintegration with the family, whether that's through the discharge process and getting the family involved with that, or you know, positive influences, and then also welcoming support into our jails and prisons through, you know, community support groups. I know in my local community, I live in Ashtabula, Ohio. In our jails, we have AA meetings and NA meetings there for the men and women in our prison, as well as in our local jails. And also, you know, faith-based representation that comes into the jails and prisons. And it's not that everybody is going to gravitate to that or that it's going to work for everyone. But if we can touch some lives within that system to create that social support before the person even leaves jail or prison, we're going to be increasing the chances for that individual to not reoffend and end up back in the same situation. Also, just want to, you know, mention that conflict is a relapse trigger, and a lot of our patients are not always well versed in how to resolve conflict. They'll either hold it inside and not really, you know, address it appropriately, and holding on to those feelings of conflict or resentment or anger many times will lead to relapse or continued use. Or they'll overreact in aggressive ways or inappropriate ways that lead to, you know, further incarcerations or further problems within their family. So, you know, any programs that we can support around conflict and stress management are going to be really good relapse deterrents. Here at BrightView, we do have programs around stress management and anger management. We have groups, and we focus on helping our patients to learn that conflict is not necessarily a bad thing or a negative thing. We all have conflict. We all need to learn that we can resolve conflict in healthy ways and maintain good relationships in the process. Next slide, please. There's proof in the numbers. We pulled some data and pulled some actual statistics. I know people really like to see quantifying data around this information, because it all sounds great. Social support is really important, but we actually have some data to support that. So what we've seen is that those who have strong social support are 1.5 times more likely to remain in treatment programs compared to those who do not. We also have seen a reduction in relapse rates, that for patients that are engaged with peer support groups, whatever those happen to be, and whatever the definition is for the person, they experienced a 50% reduction in relapse rates over a 12-month period of time. We see improved abstinence. Patients receiving consistent social support report a 20% higher rate of abstinence at 6-month follow-ups than those without it. Also, enhanced quality of life. Patients with robust social networks score 30% higher when we talk to them about the quality of their life and how happy they are on their path of recovery. And if they're not happy, they're not going to stay on it. So we really want them to have robust social networks. Also, we see increased program completion. Patients with active family involvement and family support have a 40% higher likelihood of completing our treatment program successfully. And then finally, we see decreased jail time. During the first 90 days of treatment, the time spent in jail was decreased by 70% for BrightView patients. Next slide, please.
All right, so we're just going to kind of touch on some challenges that we may see with social supports. We're going to look at patient challenges, provider challenges, and some mutual challenges that we're going to see that kind of interlock between the two. Some of the patient challenges, they're going to include, patient motivation and engagement. If someone is first coming into treatment and they're struggling with withdrawals, it's going to be hard for them to be motivated and engaged. The complexity of needs, if they come in and, as I mentioned before, if they're a dual diagnosed patient and they have multiple needs that need addressed, both physically, mentally, and they have a lot of barriers that need to be addressed, that can create a challenge. Limited resources, as we all know, sometimes we treat patients from small towns and small communities that have limited resources in them, which definitely creates a lot of challenges to getting those patients connected to the resources that they need. Stigma and discrimination. A lot of times I've heard patients, say they don't feel comfortable with going to social support groups or peer recovery groups or meetings or anything because they feel that they're going to be discriminated against or there's going to be a stigma attached to them to where they're not going to be able to feel welcome. There's also systemic barriers just in the community and different things that the patients experience in day-to-day life as far as their barriers to their recovery. Some of the challenges that us as the provider can experience throughout the process of treating our patients is burnout and compassion fatigue. A lot of times we all know that this is a population that is not easy to work with. And it's something that you have to be trained in and you have to understand how addiction works and what the diagnosis of addiction entails. And so burnout and compassion fatigue can definitely be challenges that providers can experience. Cultural and individual differences, just, personal experience, personal cultural beliefs as a provider can kind of come in the way and create a challenge for you, to treat a patient. But within that same breath, you always want to make sure you're meeting the patient where they're at and you're understanding where they're coming from and that not everybody has the same culture or comes from the same background. Client retention. A lot of times patients will come in, they may have charges and for some reason they may be arrested and have to serve their sentences out. or they may go to inpatient. They may decide to stop coming to treatment. There's various reasons why client retention can be a challenge for providers. Confidentiality and privacy. A lot of times we have to have those releases of information on file before we discuss and disclose any patient information with outside entities. And a lot of times if a patient is someone that's not very reliable about coming into their appointments, it's very difficult to get those ROIs signed for the patients so that we can coordinate care with those agencies. However, BrightView does offer an online ROI version for the patients to access that virtually, which helps eliminate that barrier if the patient is not able to come into their appointments. Managing relapse from a provider standpoint, it's hard when we see patients that's continuing to relapse, week in and week out. It's very difficult as a provider to manage that and understand what's going on in the patient's life and help them overcome that barrier. And then we got mutual challenges. So just between all these challenges we've discussed between patient and provider, there's a bunch of these right here kind of interlocking or can be challenges for both. Limited resources can definitely be a big challenge that affects both the provider and the patient. The patient being as they don't have access to that resource to use. On the provider side of that, provider doesn't have a resource to connect the patient to, unfortunately. So those are just some challenges that you're going to see when dealing with social supports and assisting patients with connecting them to resources and so forth to better their recovery. Slide. Also, we're going to touch on some factors that influence social support, the patient's needs and preferences. So their stage in the recovery process, their family support, their level of motivation to change, their willingness to utilize resources. These are several factors right here that affect patients' access and their ability to obtain that social support. If patients aren't willing to utilize the resources that's provided to them, it's going to be hard for them to address the barriers that they have to their recovery if they're not utilizing the resources that they have. Structure of the treatment or social support team, staff cohesion and happiness at work, fair, realistic number of patient caseloads. A lot of times this right here there has to be office cohesiveness. Everyone has to be able to work together to be able to treat that patient at the best ability possible. And plus the patients, can see where the office cohesiveness is. They can feel that vibe whenever they come in. And the main thing is you have to make sure that the patient is comfortable in treatment and that they understand that everybody is there for them and everybody is working together for them. Agency mission and staff training should be aligned and empathetic, culturally sensitive and competent. Our motto, our saying here at BrightView is meeting the patient where they're at. Whenever the patient comes in, we don't care if the patient comes in and they've hit rock bottom, they're homeless, they don't have a primary care doctor, they don't have housing, they don't have transportation, they don't have food resources. That's perfectly fine. You come in, we're going to give you everything that we can. We're going to connect you with every resource that's possible to make sure that we can get you back up on your feet. We also, you also may have patients that come in that are well off. They have everything they need. They may just need help with a mental health referral. So just making sure they're connected to that. And again, meeting the patient where they're at in their recovery. Some available resources, policy and funding, quality of resources versus quantity of resources. Again, just kind of reiterating, making sure that even if the resources, there's a limited amount of those resources, making sure that we connect to the patients to the best quality of resource. So if we know that there's one resource in town that was going to better fit their situation or their recovery versus another, it's important to get them connected to the appropriate resource. Next slide. So what you can do as a provider. So normalize the use of social services as a positive support tool. So, other patient successes that they've had, you have to understand that with social services, everything that a patient is trying to get from outside resources, we have to make sure that the patients understand that what we're connecting them to is a positive support for them. And we're trying to get them connected with something that's going to help them better their recovery. Educating patients about available services, clear and concisely in everyday language. A lot of times, around the office, we get caught up in medical lingo and speaking in those terms. A lot of times when patients comes in, they may not necessarily understand what's being said or what's being presented to them. So making sure that, again, you're meeting the patient where they're at, and understanding or making sure that they understand what they're getting from you and how it's helping them. Making sure invest in your staff and training, taking accountability for educating yourself. Make sure that you're, as a provider, we want to make sure that we're getting all the education that we can that's going to allow us to treat our patients the best and make sure that we understand how addiction works and what we can do to make sure that we're enhancing their recovery as much as possible. Collaborating across services, streamline referrals and communication externally and internally. So sharing resources with coworkers. If you find a resource that would be helpful to patients in general or a specific patient, make sure, it's important for providers to be able to share that information across the office, across, the staff, just to make sure everybody knows these things, because a lot of times we get busy and, we may not be available for the patient whenever they come in. So if other members of staff has access to that information as well, and they're not busy, that allows the patient to still get access to that needed resource. Try to involve family in plans, offer counseling or education. Whenever patients come in, it's important to ask them, about people that are important to them in their life and people that have played a big role in their lives. And being able, if they're understanding about that and if they're agreeable to have that family member or that support person involved in their treatment, then, it's important to have the patient sign the ROI, sign the release of information so that we can make sure that we're involving that social support in their treatment. Encouraging the patient on goal setting, autonomy with your advocacy, use motivational interviewing. So making sure that you're really paying attention to the patient and understanding where they're coming from and what they're needing, and discuss with the patient about goal setting, seeing what their needs are and what they need, how they need to set their goals or how they would prefer to set their goals so that they can achieve the goals that they have set, and make sure that they can accomplish what they need to better their recovery. Staying updated on policies, advocating for integrated funding. As a provider, it's always important to stay up to date on different policies that change from day to day. There's different policies that start, there's policies that end, there's grants and everything that happen and can start up from time to time. So it's important to be knowledgeable of those things, so that if there's for instance, if there is a new grant that comes out that starts, that would be beneficial for patients to utilize. As a provider, we need to be aware of that so that whenever the patients come in, if that's a need that they have, we're making sure that we're getting them connected to that resource to help them in that situation. Next slide.
Okay, we are going to jump to the questions. I encourage everybody to enter those in the chat, questions they may have for our panelists today. We have a few already that you have asked us during the registration process. And I will start with the first one. Is it possible to provide clients too much social support?
Well, I'll jump in with this. I don't know that there's such a thing as too much social support. I think, when someone is entering recovery, they're going to need help in several different areas. And so, just extending to them as much as we're able to, and capable of. I don't think that we are going to overdo, offering many different forms of support to those who are initially entering recovery.
Great.
I can piggyback off
Yeah,
that.
please
Well,
do, Sarah.
Um, also, like she made a very, very good point. There is no, I think, end to social support, but it's very important as well to kind of keep in mind like where they're at in the recovery as well. Because when they get farther on in the recovery, you have to kind of evaluate, is it they're just not wanting to do things, or, you know, are they really just not wanting to do it and take the time out, or motivated, I guess, to do it? Or, so you kind of have to make boundaries as they get farther on in the recovery and allow them to just do things to grow in their self identity. You know what I mean? So that's pretty important. I don't think there's more, like too much, but you do have to make boundaries, basically.
Mhm.
That makes sense. That's great. Yeah. And when it comes to our next question, we're talking with and helping justice involved patients, that have just started reentry. Let's say, they've only been released, say, a couple of weeks ago, and are in your office. How do you recommend folks navigate recovery resources for men and women when that is the case? Because, obviously, the thing that most struck me about case management when I first learned about it being part of our offering when I joined is just, of course, addiction has done so much to your life. Of course, you have things to rebuild. It would seem like that task would be even more pronounced for someone involved in reentry.
Yeah, I can touch base on this one here. So we know, when patients are starting into treatment, they're finishing their sentence in jail or prison or whatever institution they're coming from. A lot of times patients will have that institutionalization factor playing there. They've been incarcerated for an X amount of time. They're used to being inside of one building and having access to pretty much nothing. So whenever they come out, and a lot of times they're needing things like their birth certificate, their social security card. They're wanting to get started in life, and they're wanting to get back to work. They need housing, so on and so forth. Situations like this is when it's important for providers to have as much knowledge as they can of all the different resources in the community, especially to those that are coming out of incarceration that may have a criminal background. That will have a criminal background, that will need resources that are better fit for them. If it's employment they're needing, we need to make sure that we're connecting them to felony-friendly employers or second chance employers so that they don't kind of hit that wall when applying an interview.
Yeah, I'll just jump in real quick with what Trevor said, because that's such good stuff. The other thing that I do as a therapist when I'm working with patients is ask them, what do you want? What do you want to do? What's important to you? Because what's important to me might be completely different than what's important to them. And if I get their buy-in and we prioritize the list based on what they want to accomplish and they see as the priorities, we have a better chance of being successful. So always asking the patients, and kind of coming to the table with them from a standpoint of asking them, what would you like to work on? What do you want to do? And of course, we're going to inject in and encourage, some certain priorities like housing and things of that nature. But the more bought into the process they are, the better chances that they're going to start to feel some success. And then the success will just start to snowball into more and more areas of support and growth in their recovery.
And to that point, that we said earlier, can you provide too much support? How do you provide specific support for justice involved? I think there's a understandable desire by our, folks attending today to want to be prepared for any and all possible questions or needs, right? Like I know I typically will ask case managers when I'm in conversation with them, what's the not weirdest, but just most unique thing that you wouldn't have expected to have created as a resource for someone. And I think, it's just extensions of things you wouldn't think to have on hand, like getting them a health club membership. This person wasn't just as involved. They were a little bit further along in their recovery. But I think that the key thing is less having everything mapped out, right? Like you're not going to be able to do that. Every patient is different. Every need is different, right? But it's the ability to figure out and find those resources as needed. I would imagine that's probably a critical skill. Am I onto something there?
Yeah, I also would like to touch on that too. Another important and very important aspect of that is to kind of evaluate and fill out what the patient's needs are, as in mental health aspects as well, throughout, as they're coming out, and maybe portraying just being withdrawn, maybe, or just having bad experiences, or so they may need some referrals possibly to some mental health aspects as well. So I feel like it's a composition of physical, mental, all the stuff that they may need help with too.
Great. Okay. And there's also a question here about patients that are reluctant to trust anyone, right? For any number of reasons. Obviously, this is a disease that is usually started with trauma, or there's trauma involved in somebody's life. So trust may be a huge issue for them. Is that something any of you guys have experienced? How, if that's an issue that a patient is having, how do you recommend somebody potentially try to address that?
I can jump on here. I've had patients in that same situation in the past. They're first coming into treatment. They don't know anybody there at the office. They're not aware of who their counselor is, case manager. They're just getting to know everybody, and they're their trust is they're very hesitant to tell anybody about their situation, their past, or anything. And so I think it's important that whenever we see our patients, that we make sure that they understand that we're there for them. We're there to hear them. We're there to support them in every way possible to make sure that they get back into everyday life as best as they can. I've had patients that are not comfortable just coming in to talk to me, doing an assessment to see what they need. They're not comfortable with telling me what their needs are. And a lot of times, whenever I have patients like that, they come in that aren't very honest. And I can tell that whenever I'm going through the assessment and they're just answering no to everything, I kind of take a step back and just briefly ask, hey, I just want to make sure that you're answering these truthfully, because that's how I'm going to be able to help you. This is an open discussion room here. Everything here is confidential between the patient and myself. And again, that is another aspect that I think when touched on with the patients, confidentiality whenever they understand that that as a provider, we can't legally break their confidentiality other than certain circumstances. And I think that making sure that the patient is aware of that can definitely help that trust aspect of it.
Also, I would add too, just kind of portraying and being that non-judgmental, empathetic person that provides them support basically and letting them know that it's okay to be where you're at. If you're not, able to answer this right now, we can go back to it, and allowing them to basically be themselves. And if you don't get that complete rapport in that first like session with them, that's okay too. Because it will come usually, but you just have to kind of let them know it's okay to, feel what they're feeling, go through what they're going through. Um, and sometimes I do share with them that, I've been where they're at, depending on if it's helpful to their recovery. I never make it about me. So if I feel like as if it will help them kind of gain that rapport and that connection with them, that's can be helpful as well. So that's a very good way I feel like, and it's encouraged a whole lot of my patients to kind of open up or even just feel comfortable. I had a patient today that was the same way, and they said they were the most comfortable at this BrightView that they've ever been, and they feel so welcomed and loved. So, and that's my goal. My passion at the end of the day is to help somebody.
Yeah, that's a great point, Sarah. In fact, somebody, as you were talking about that, added that, being a former patient themselves, it's kind of a relatable factor, as you've mentioned, your lived experience, that, when that is applicable, it has a great impact. And I'm assuming too that honesty, if you don't have that same relatable experience and being, and letting them know that even could, be a good thing. Another question that we've just gotten from the audience is, how do you recommend we best support people who face active racial oppression and or identify outside of the gender binary in their recovery?
I think I can jump in. I think the fact that here at BrightView we have a really robust diversity and inclusive and inclusion committee, and we work really diligently to try to make sure that we're offering services along those lines, and even our groups and having some groups that specifically focus on that, depending on what the need for support would be. I feel like reaching out to those that are really involved in our diversity and inclusion department and committee, and really helping to identify the specific support that would be needed for that patient. So it would really need to be individualized, and from a professional standpoint, sometimes reaching out to others and saying, hey, I have this this situation with my patient, and their need is specific. What supports do we have available, or what supports in our community or their community? I work with patients all over the state of Ohio, so there could be different resources in different locations and communities. So I would, and I don't always know what those are. So I would personally be seeking some help and assistance in navigating some of that.
That's a great point, though, reaching out to your colleagues who are, in similar roles. And there's ways to do that without, breaching that confidentiality, obviously, too. Very easy to do. That's a great point. I think that sums it up really well. So,
Also, just
one final question for you guys. Healing is obviously ultimately up to the patient, right? And you know, it's a full contact sport, if you will. How do you guys, you know, recommend others inspire their patients to follow through? You know, you give them that the access to those resources. What do you sort of think is the best way to get them to follow through with that?
I think just sharing with the patient just some, you know, stories from your past that's, you know, exemplifies how utilizing specific resources can better their recovery. You know, giving them examples, saying, you know, I mean, I've had situations, I've had patients before where, you know, they've been very reluctant to accepting the resources, to utilizing those resources. And I just let them know, like, hey, you know, I've had patients in the past before that, just for an example, psychiatry. I'm not to disclose any personal information about the patient or anything, but I've had a patient in the past at another job that was very reluctant to accessing psychiatry services, but it was something that she needed severely. And I worked with her, you know, months and months on end to make sure that, you know, she was trusting of me and that she understood how beneficial that resource was going to be for her. I make sure she had access to articles, resources that showed how much psychiatry helps mental health and how much it can play a factor in helping your overall recovery. And, you know, after 5 months went by, she started transitioning to make sure, you know, she was going to appointments, stuff like that. And she got more comfortable with it. And then eventually she was going to her appointments. She was obtaining treatment. And once she started obtaining treatment, she got prescribed the medication she needed, started realizing how that medication was helping her and how much better she felt and how much better she was able to focus on her recovery. So that's just a good story that I always keep in my pocket, just to show patients how much these resources can help them.
I would just say, you know, just reminding patients that, you know, the opposite of addiction is connection. And you don't have to have a huge circle of connection as long as you have small, meaningful, supportive, you know, tribes that can help you at any stage of your recovery. That's going to really set you up for success. So that would be my suggestion and advice.
All right. That is a great way to sum it up. The opposite of addiction is connection, right? And I don't think we can get any better than that. We are out of time too. So with that, I just want to thank everybody for joining us today. And obviously most of all our speakers for sharing their expertise with us. We appreciate everybody and hope you have a great day.